Welcome to the Mental Fitness Podcast in partnership with Untitled Chat, where we explore real tools and stories for building mental strength in the modern world.
Thanks for having me on the podcast, John Sanders, family doc. I've been in practice more than a decade. I love people, and I grew up in a mining town in Nevada and went to UNLV for undergrad, the opposite of BYU. I joke with folks around here. And then I went to Florida for med school and residency. I lived in Taiwan for a couple of years, did a mission there, and then
you speak fluent Chinese,
Mandarin.
Fluent Mandarin.
Yeah. And then I went to Moab in rural medicine and did everything from delivering to babies to ER to hospital to clinic to sports doc on the sidelines during the home football games and then hospice as well, which was really satisfying. Like both that whole scope of taking care of people was really beautiful. And then we moved here 8 years ago. I started Voyage Clinics then in an effort to kind of fix the broken healthcare system and deliver something different than the current healthcare system delivers as far as a care product. And yeah, that's kind of me. I got 4 kids, sweet wife. Yeah.
It's awesome.
Well, thanks for coming on the show, Dr. John Sanders. One thing we think about a lot at Untitled Chat is how most of our systems, especially healthcare, are designed to respond to breakdowns rather than build strength ahead of time. And it's no different in mental health, right? So as someone working in primary care, we're curious how you think about prevention, not just as an ideal, but as something that's actually possible to implement in real lives and real systems.
No, totally. Thank you. I think primary care is like the preventative healthcare specialist. Like that's what we do. And we talk about it. We do like skin checks. We do cancer screening. We do emotional wellness screens and things like that. And to me, we've coined the term sick care. Like that's been out there for a while now. And it's true. Like a lot of our medical institutions are designed to provide care to the super sick. And then it's like a rescue situation, like crashing and burning and, the ship is going down. And we're really good at that. Like maybe like ethically, maybe that's not such a great thing as sometimes. Yeah. I just had a discussion with a general surgeon in the doctor's lounge at a local hospital just today about the ethical dilemma around sick care and how we're like fixing this burning building instead of like doing what we do in family medicine, where we're taking care of, how do we prevent that burning building? Like how do we not let that building catch on fire? And so, no, I think this is super cool. And I'm super passionate about prevention and in all the spaces. I also have a cool podcast. My clinic is Voyage Clinics and probably 1 in 3 is mental health professionals on my podcast because I'm so passionate about it. I think it's so good.
Awesome. We talk about the concept of a fence versus ambulance. So imagine there's a road that just ends and falls off a cliff, and there's people that are just driving off this cliff. And so how do you solve this problem? You can put a bunch of ambulances at the bottom of the cliff, or you can build a fence at the top. And we're trying to build the fence, but it feels like the system. And it's not that necessarily that anyone has a nefarious motive. It's just when you arrive on the scene and there's a bunch of people at the bottom, you're like, we need to get a bunch of ambulances here. And then you're so focused on fixing that problem that cars keep coming off. And so you just stay so busy in that space.
I would like nefarious motives. I agree that the physicians almost never have nefarious motives. We went into healthcare to take care of people.
Yeah.
It doesn't matter if they're a jerk neurosurgeon or a kind pediatrician. Like we're all like, we will passionately take care of people. The snafu to prevention is value of prevention. And for instance, like in the psych space, they don't cover, right? Who's they? Who's they don't cover, right? It is they.
There.
Yeah, those guys, those rascals. So until they get on board with like true prevention, like, and valuing it, like primary care specialists continue to be the most underpaid doctors of all the specialists, right? And until they actually look at that and say, hey, we actually value what you do. And for you to spend an hour with somebody like talking about prevention, smoking, diet, exercise, like really kind of going through it. Like, I think we can remunerate that better. I think you're going to see some changes until they'll actually let me send someone to a psychologist or a licensed clinical social worker or a therapist for prevention. Hey, y'all are about to get married, or y'all are just newly married. Let's send you for preventative relationship therapy. Like, let's do that. Like, gold.
Instead of waiting until there's
why are we crashing
on the
and
brink of divorce?
The building is burning. Now we're trying to put it back together.
So there's likely some financial incentives for the insurance companies or the payers to do that, but it feels like to me it would be the opposite, that they're getting paid a certain premium and they have to shell out a lot of money for sick care, and the preventative care is massively less expensive. So you would think that by them paying these preventative things that they would save a lot of money, that their margins would go up. Or is that not true?
I think they're short-sighted, and I don't know why they have never been on board with that. I think they're starting to, like you're seeing some things go that way. But even the fact that we're having this discussion that we're relying on a third party to actualize preventative healthcare in America is silly. Like,
that's crazy.
Why are we even looking in their direction to feed this movement? Why don't we just do it affordably, transparently, affably, beautifully? Why don't we just do it? And I'm part of a movement of family docs doing just that nationally.
That's why we wanted you here.
And it's beautiful. And we're doing it directly with people instead of having a payer decide what they're going to cover. What are they going to cover that lab? Mm-hmm. They're not. They could. I don't know. Maybe. But with us, that lab costs $5. But with them, they could cover it, and then it might cost $0. But if they don't, it's $125. And so just things like that, like if you just put people back in a relationship with their doctor, then I think directly without a third party, then we can do whatever we want. Like I have therapy built into my practice for free. I pay for it. I think it's valuable. I think it's important. And I have some team of therapists that I work with that when I feel like someone needs preventative mental health things or proactive, or like building's burning, we need some mental health touches here, they can do that. And I don't need an ICD-10 code. I don't need to link it to an insurance plan. I don't have to do any of that stuff. We can just do it. And it's amazing. Lovely. It's lovely.
And so when we started Eliza Chat, which is the sponsor of this podcast, when we started Eliza Chat, it's around preventative mental health care. And I mean, in the mental health care space, when we talk about insurance companies, we're coming around to where even some mental health care services are being paid by insurance companies. You rewind 5-10 years, there wasn't even mental health care therapy covered at all. Payers are getting on board with providing more services there. But our whole model was, let's just bypass the insurance company altogether. Let's build a scalable platform that is cost effective enough that people can afford out of pocket prices. But it's sort of just a different angle of solving the problem. That only works in certain areas, right? In most areas, the cost of care is beyond what the average consumer can provide for, and so you need the insurance company's cooperation.
Yeah. I mean, the insurers and payers, like getting them to come along is one thing, but you talk about, you and those doctors nationally working with patients and just the general population. Do you think the average person knows what preventative healthcare looks like, or are we still learning how to talk about that as a society?
I think it depends on where you're at in the nation. I trained in the South. I love the South. There are a lot of unhealthy folks in the South. And I grew up in a mining town in Nevada. There's not a single person there that understood prevention. Yeah. We were like 250 miles away from the nearest Walmart. So it depends on kind of where you are. I think nowadays we're getting more and more thoughtful about health and wellness and prevention, but sometimes it's misinformed and sometimes it's reasonably informed. And so that's a hard situation with the age of misinformation. But I do think I think folks are getting better. I think in our neck of the woods in Utah, like there are a lot of folks that are like super preventative oriented, they're preparation oriented, and they want to be healthy. They want to maintain a strong degree of that. So I think in like maintaining their own health and wellness they're pretty good as far as physically. Emotionally, I feel like it still lags. We still have a tremendous paucity of preventative emotional health. I mean, let's just think about like cognitive behavioral therapy, just simple, like straightforward. The way that you think affects the way that you feel, and healthy thinking patterns affects healthy wellness and believing patterns. And this is like reasonably evidence-based like stuff. And it's frontal cortex-y, and I get that's not emotional therapy, but it's still awesome and it's still very effective. How many people actually know about that, and how many people gain access to that, and how many 8th graders have gained access to that? Like, to me, this is like school curriculum, like in health, call it health, but let's teach emotional intelligence. Let's actually create an emotional intelligence curriculum for definitely probably 6th grade. Definitely teach it every year until like 9th grade, and then once again in high school or twice, and then again for like 20-year-olds, and then once again in 30s. Like, do some preventative curriculum for folks that's reasonably affordable.
I love that you say that. Like, I mean, physical education, PE is normal in schools, right? Like, why not mental fitness or mental education? Yeah.
75% of lifetime mental illnesses start in childhood and adolescence.
Yeah.
And so if we want to get truly preventative, it's also starting earlier in everyone's lives.
That's so true. I see so much what I would consider emotional trauma, and I see a ton of it. And we actually are very comprehensive on our treatment of that. We do ketamine in the office. We do very innovative, really beautiful work for folks and really helping them heal. But often we see that trauma start when they're young, and it's not always a profound event. It's not always like, sometimes it is, but sometimes it's not like, well, like, no, my dad, he sternly talked to me, and then I started believing a certain thing, and I never stopped believing that. And that script is stuck in my brain. And so this emotional trauma situation has affected this person for years and years and years and years. And they got to roll that all the way back to their childhood where, that's where it was. And that's where we started that script. And can we now shift that and re-dialogue that?
You mentioned in your practice, you do a lot of sort of screening for these things. What kind of signs tell you that someone is emotionally or mentally overloaded?
I think signs are things that we're kind of seeing. Symptoms are things that they're kind of feeling. I see folks come in, like I saw a gal today, her GAD-7 score was 20. Which is general anxiety score.
So 10 is like
15 is like pretty severe, like moderate is 10 plus.
Wow.
So she's like through the roof. She comes in and she looks like she has, like, her sympathetic nervous system is on point. Like she's fight or flight right now. Like she's psychomotor agitation. She's like twitching a little bit, and she's talking really fast, and she's just pressured. Like there's a whole bunch of physical manifestations there. And so just like listening, and not just with your ears, but with your eyes and your heart, you can kind of like feel the anxiety coming off her. Right. And in our current sick care system, time with person is continuing to erode. And so taking care of people is harder when you don't have actual time to actually listen, to actually see those signs and symptoms, to run through a questionnaire. I sat down next to her. We talked for a long time. I knew she was like pegged, right, anxiety-wise. And I was like, well, just for fun, because I was teaching a med student at the time, I'm like, we're going to go through this questionnaire. And so we did, and I didn't need to. I was like, no, you need this.
But it helps her to see.
Well, it helps a med student know that.
I answered questions. This is a score that came out of it.
Yeah. So we did that, and yeah, it was profound. Yeah.
So the GAD-7 is general anxiety disorder, 7 questions. Do you do the PHQ-9?
Mm-hmm. And there's a 3 as well. You can just
PHQ-3.
ask 3 questions, and it's almost as sensitive and specific as the 9.
Yeah.
And for those docs who are pressed for time, maybe that's an okay screen.
So you do some of those screener sort of surveys to get scores. Are there any other kind of surveys you do, or?
We do obviously all emotional health, right? So we do attention deficit stuff. We do, for adults, for kids, for all those spaces as well. We're autism screening stuff as well. And so just kind of looking and observing and talking and listening, and sometimes using screening tools as well. Mm-hmm.
Yeah.
But the most powerful tool that we use in my office is 30 to 60 minutes with people.
Yeah.
Which is way different.
Irreplaceable.
It is irreplaceable.
Well, let's talk about that a little bit, like your model, direct primary care, right?
Yep.
Versus, traditional. Talk to us about that a little bit.
Oh, it's just so beautiful. It saved my career. I almost quit because all the bureaucratic box chicken bull crap rolls downhill to the family docs and pediatricians and internal medicine, the primary care specialists. And it's hard. It's heavy. Stacks of paperwork to sign every day, like just the hoop jump through these insurance companies' silliness, and creates inefficiencies, and spending 90% of my time with my computer and not being able to really connect with people and really help them. And then the erosion of that time with people, like administrators telling you got to whip through more patients per hour, or we got to cut your pay, and all those silly little games, right? And so I almost quit. I was like, well, maybe I'll just sell kittens out of my trunk. I feel like that might be more meaningful. And so instead, I've discovered direct primary care, and it's just a membership model that's reasonably affordable. People have been doing membership medicine for a long time, concierge and boutique medicine, but these are like white collar prices. So their price points are like 5 times what I charge. And we're just kind of like concierge for the people, like the Robin Hood of concierge medicine. So that's a good way to think about the difference between concierge and direct primary care.
I heard someone describe you as Robin Hood, the Robin Hood of the medical system.
That's funny. But no, I do. I'm very cognizant of price points and being affordable and being available and being affable, and the things that are like low hanging fruit, but they're also really important. So just time with person. I was talking to my med student today about this. Trust is magic. Trust is magic. Doesn't matter in health, in life, in mental wellness, and in medical stuff. With trust comes magic. And the magic is really, I hate to call it this, but it's placebo. How often does placebo work? Like 30% on average. Like, that's incredible. So that's magic. Like that, I'm giving you this fake thing, and you trust that what I'm saying is true. Therefore, it's going to help you. So we kill placebo. We kill that magic. We kill better outcomes, 30% better outcomes when there's no trust. And by eroding that time with person, we're eroding trust, and we're eroding the magic of caring for people.
There's probably something also about genuine human connection and empathy, and when you feel cared about, that's beyond placebo.
Yeah.
Right? When you feel cared, your wellness improves.
More deeply human about that. Yeah.
And when you express care, like my scores improve too. Because I have time and I have bandwidth for it. And whereas before you're grinding so hard, you're just like, you're sarcastic, your relationships aren't as meaningful, your connections aren't as meaningful. But I agree. I think with that feeling cared for and being the caring for that person, there's magic there too, for sure. Yeah.
What, to turn the page a little bit, what's your thoughts on, there's definitely a connection of physical health to mental health, right? And mental wellness. What role does that play generally? Or can you think of a time when, you helped someone address a physical issue and it unlocked better mental wellness?
Oh, this is like so important. Thanks for asking this question. It is 100% connected. There is no bio only. It's all biopsychosocial, all of it. And it's not just biopsycho, it's biopsychosocial. So like what you do on your own time and how you socially interact and socially positive, activities and things are part of your wellness journey. How many coaches in any sport have ever said like, this sport is 90% mental?
True.
It's all true. Yeah. It is so true. Same, the game of life, right? It is hugely mental. And even if I'm seeing somebody with diabetes, I'm seeing somebody with high cholesterol, or the number one killer in America continues to be atherosclerotic disease, which is like plaque buildup on your blood vessels, right? Heart attacks and strokes. That is not the problem, right? The problem is, well, there's a whole bunch of reasons. It's multifactorial. But one of the problems in some folks is I have a bad relationship with food. And partially it's because Americans' food is poison. Like we just poison all our food. 80% of our food chain is processed bullcrap that is designed to addict you to more food and make you overeat and all that. So that's a whole nother podcast. We'll do that next time. But then there's maybe an emotional connection there. And in the South, we call it like comfort eating. Man, I just feel so good. This pecan pie like makes me so happy. And so, maybe my relationship with food needs to change. And so that's why we incorporate it into our practice. Cause man, I need this person, no anxiety, no depression, but just a poor relationship with food. Can they just talk to somebody about that? And if you don't have a code and you're using insurance, you can't. But in my shop, you can. And I just send them. And then they're like, sweet, we're going to talk about relationship with food. Awesome. So yeah, I think it's huge. The emotional space, the emotional intelligence is, I would say, as important as physical health. Yeah. We see a lot of like functional neurologic disorders. It's a kinder word than psychosomatic. So you may have heard of these where somebody can, from a mental illness space, create physical things that manifest.
Mm-hmm. Yeah.
And this is it's not uncommon. And so we see things like psychosomaticizing some neck pain or psychosomaticizing even paralysis. Like I've seen some really, really dramatic ones. But it's amazing. The power of the brain in the body is so, so important.
And the thing is, just from the little bit I understand about pain is pain and it's real. There's the pain as it's perceived in the brain is real no matter what, but it could be caused by something mechanically wrong with your spine or your muscles, or it can be in your head. But by the time you're perceiving the pain, it feels just the same as if you actually had a neck problem. And so it's not just people making it up and pretending to be in pain. They are in pain. The difference is the solution. The solution to an injury in my leg might be physical therapy on the leg. And if it's something that I've built up in my mind, then it might be therapy of the way I'm thinking or why I'm feeling that. But at the end of the day, it's still pain. It's
still real. And yes. And that is a common misconception. And that's why I think renaming it functional neurologic disorders is better. Psychosomatic makes everybody feel like I'm psycho and I'm somaticizing something that's not really there. No, they are legit feeling what they are feeling. And it's not all in their head, but their head is the big part of it. And so entertaining the thought that it might be is step number one. And then helping them navigate toward, tools and people that can kind of help them unravel that mystery. Cause it can be really hard. It can be really hard. And if you only have 5 minutes, you're not going to do it.
Yeah. Well, the question I just thought of now is diagnosis. And I'm probably going to not say this question in a great way, but hopefully you understand what I'm saying.
Yep.
I feel like in your model, the way you go about diagnosis is different than a doctor that sees you for 5 minutes, right?
Totally. So I just had this talk with my med student today as well. So horses come through the door all the time. Horses are common things. Common things are most common, and you're going to see lots of horses over your career. And occasionally you're going to see a zebra, like something less common. And in a 5-minute visit, you can't get a zebra. You won't, and you'll miss them. And so these zebras bounce around in our healthcare system, frustrated, getting 5-minute healthcare visits. Even if they get 10 5-minute visits, it's not even the same as one visit in my office, because we can get past that surface level care. We can peel back the onion, peel it back again, and actually hear people and listen and use art in healthcare. Art in healthcare is beautiful, and it is listening with just more than just your ears. Example, there's a gal, she came in and she had this problem, and she was just putting it out to me, and I was like, oh yeah, cool. So I'm asking her lots of questions, and we're kind of diving in, we're getting it all figured out. And as I'm about towards the end of our visit, I'm like, there's something else there. And I said, in your story, you mentioned this, and I just feel like there's a rock there we need to turn over. Can you speak to that space again? And she's like, oh yeah. And she like unpacks this giant thing. And I'm like, that's the thing. Actually, we were looking over here, but it was that grandpa trick, right? He's looking over here and he smacks you with his hand. And because we had time and I was able to like kind of feel, right, while I'm listening, I said, there's something deeper here, and let's talk about that. And it was so cool.
That's amazing.
Yeah.
I love your holistic approach to care, that it's, like you said, it's everything. Our mental and our physical, our emotional, our well-being is all intertwined. We talk about mental fitness, and one of the 3 pillars, I mean, we have whole episodes that just focus on what mental fitness means, but one of the 3 pillars of mental fitness is just our physical vitality, health and vitality. And in that pillar, it's sleep, nutrition, movement, those types of things. And so we spend a lot of time talking about those areas and building features around those in our product, even though it's like, wait, I thought this was mental health. And it's like, well, yeah, but you can't be mentally well if you're not sleeping, if you're not eating well, if you're not exercising. So when you think of the term mental fitness, how would you define mental fitness?
I mean, I love what you guys talk about with incorporating the physical into the mental space. And it's so true. I think just as we just said, like the mental is so it has a lot to do with the physical. I think the opposite is also true. Like the physical has a lot to do with our processing. And so caring for the whole, I think, would definitely be super smart. I've been working my equation in my clinic for 8 years. How can I help people better? How can I bring more value to them? How can I serve and connect and help and improve health and wellness and prevention? And one of the things my wife and I created is like a health coach program, right? And it's very similar. Like we build on the foundation of sleep, mindset, and micronutrients, and consumption and all those things. And we kind of like talk about all those spaces. And mindset is so key, right? Like the emotional, where are you at today? And what is your intention? And creating those spaces of just overall health and wellness, I think, is part of that fitness, right? The mental fitness spaces. It's all connected.
It's interesting. I think we're very aligned, but coming from different angles.
Yeah.
Coming from the healthcare world, you're bringing in saying, hey, we need to consider all of the mental and the emotional stuff into this, which is very different from the way 99% of doctors are treating care. And we're coming from the mental health side saying, hey, we need to consider the physical. We can't ignore all the physical because they're so intertwined. But I think what we believe is a healthy, happy human being is very similar in terms of how all these things come together.
I think you're so right. And it's kind of like medicine 2.0 is over here. And it's all left brain, it's all science, pharmacology, anatomy, physiology. And that's fine. And grinding through that in your career is really important. And knowing science and knowing how things work is great. But I think sometimes we over accentuate that and overemphasize that. And we fail to really bring in the rest of the equation, and really teach neuropsychology, teach neuroanatomy, right? That's cool, but like teach the psychology space and let's combine both of those. Medicine 2.0 is just all left brain. And frankly, it's all we have time for. With a 5-10 minute visit, you don't have time for any art, any right brain, any connection, any kind of trust, any kind of relationship building. You don't have time for it. And my administrator told me I have to see 5 patients per day, and insurance doesn't pay half the time. And so here's all this inefficiency with that whole mess. And so now I think just getting to a space where you can deliver actual care to people is so important, and it's just so satisfying for kind of everybody involved. In medical school, it's all it is. In residency, we had a psychologist on staff, and most all residencies, at least family medicine, has a psychologist on staff for 2 reasons. One is we're working 80 to 120 hour work weeks, supposed to cap at 80. Everybody says we capped at 80, and that's fine. But there's high stress, right, among the residents, among the attendings, the old gray hair guys, and the young people that are grinding it out. And so the psychologist kind of helps with, mitigating damages there and helping folks with emotional intelligence and stuff. But they also collaborate with us in taking care of people. And so that's where, I love emotional intelligence. I've always have. I thought about becoming a social worker before I went to med school. But this psychologist was super cool in my training that she's like, well, why don't we just see some people together? And I'm like, really? We can do that? She's like, yeah. So she would go through, cognitive behavioral therapy sessions with folks. And I would sit there and be like, oh, this was amazing. Like, I don't know. I need to learn this stuff. Like, this is significant for me as a person. And why was I never taught this? And so anyway, I think it's getting better. We can do better for sure.
It's fascinating.
We try to share some, practical advice for people, listeners on this. What daily habits, that could be simple, do you recommend to patients to support both physical and mental wellness?
Read about and understand sleep hygiene. I think the clickbait stuff and the phones and the screens are like probably degrading our brain cells by tremendous amounts. They're messing with our dopamine levels, baseline and spiking. So being cognizant around screens and setting up boundaries to them, because you have these screens, these programs, these social medias, these TikToks, all these things, they're all very sophisticatedly created to keep you there and hold you down and pull you underwater and keep you there.
I worked for big tech for over a decade, and I see that they hire the smartest people on the planet to make these things as addicting as possible. And it's profit driven. And like I said, I don't know that they have nefarious motives. But they're driven by profit, but not necessarily considering the long-term implications of what they're doing.
I think is the single most important thing we can address as a world, not as a nation, as a world. Like, what are we doing? And do we need to pivot? And maybe we all need to join the Amish, because honestly, it's not a bad way.
I know. I just want to, for the listeners, I just want to emphasize this point. We're talking with a medical doctor, Dr. Sanders, and we're asking, what are the daily habits that can contribute to someone's physical and mental health?
Put down your phone.
And his first response is sleep hygiene, and for that to be successful is limiting screen time. And I agree with you. This is why I'm emphasizing this point, that sleep, and we've talked to a lot of psychologists and therapists, and they say the number one thing you can do to improve your mental health almost always is just improve your sleep. And we had a sleep psychologist on, and she talks a lot about the physical and the mental health of sleep. Just good sleep. What our bodies naturally, our brains and our bodies, it rejuvenates itself when we're sleeping, and how these devices, this technology is disrupting that at unprecedented levels.
Next to air, sleep is the next important thing. Breathe, and then you got to sleep. Because you can live a long time without food. Probably water second, and then sleep will be third. You can't live very long without water. You can live a long time without food, but you can't live very long without sleep, actually. You go 3 nights without sleep, you're cooked.
Wow.
So I think that is so important. The dopamine bath, just the science around to the dopamine bath of screens is sound, and it is scary. And if you're just constantly bathing your brain in dopamine, which is doom scrolling, it's clicking, it's like moving to the next thing, and it is super unhealthy because you're spiking your dopamine levels so high. Dopamine is the get up and do things and be motivated and accomplish things in the world, right?
But your baseline changes too.
Your baseline changes. So now you're bathing it, and then you have a big plummet. Yeah. So outside of doom scrolling, I have no desire to get up and do anything. Oh my gosh, nope. I'm not motivated to pursue music or fun or creativity or have boredom and have some cool things happen. Like I am pegged out.
Exercise, goals, all those things go down.
Yeah.
The more time we spend. Wow.
But cool thing about nature medicine, I'm into nature medicine. I do a lot of time in nature, mushroom foraging and Shinrin-yoku and all kinds of good stuff. 3 days in the wilderness resets everything. Sweet. And why? In the wilderness, the sun sets and you're like, I got to work to keep these lights on like it's battery and it's not going to work very long. So then you're like, well, got nothing else to do. I guess I'm going to go to bed. So you're in bed with the sun, and then you don't have the doom scrolling thing because you're out of cell phone service. And then you wake up with the sun because you're like, sun's up. I guess I got to get up. And everything resets 3 days. Beautiful. Spend some time out there.
I love it. Over the years, I've done lots of camping trips and various trips with youth groups. And it's been interesting over the years some are more resistant than others about giving up the phone for the week. When we've successfully had no devices, first day or so, their kids are basically detoxing and they're like, I want my phone.
Mm-hmm.
But after just a couple days, the engagement, the physical activity that they talk about, the trips where we are out of range or there's no devices available, and the enjoyment level and the memories that are made are way better. And then I've had some unsuccessful ones where we've been in range and we haven't been as strict on the phones, and it's just like, it's not really anything unique. And so my personal experience just lines up with what you just said there about and that's just an important point. 3 days in nature resets everything. No device.
And it's probably shorter with kids. Like adults, we take a little bit longer to reset. But kids, man, like you experience it after day one, right? Like 6 hours, they go through this withdrawal thing, and then the rest of that night they're reasonable. The next morning, like, oh, cool. So kids probably a little quicker. That's awesome. Yeah. And we talked about limiting, being aware, cognizant of screen time, getting better sleep. And then the second one, I just put like exercise, like move your body. And even just like level 2 exercise, which is walking. Yeah. Like literally take a walk in your neighborhood twice a day is so good for your brain, so good for your body, so good for fat, like visceral fat. You're burning fat more than sugar if you're just taking a
long walks are better than cardio.
You got it.
Or fat burning.
You got it. That's that level 2 cardio, which is just like a long walk. And so yes, absolutely. And then so exercise, sleep, screen time, and then just eat better. Like processed food messes with your brain, messes with your body, causes inflammation. Like our diet in America is atrocious, and it's hard. It's a cultural thing, like cake and ice cream at every holiday and all the things. And
just to double click a little bit in that, eating better, I think we all agree with that. But and I think we all know, okay, fast food, like things to cut out. And we have episodes dedicated to nutrition, but just real quick, what's your 30-second things to focus on from a nutrition standpoint?
You bet. So number one is 80% of your grocery store is crap. It's just crap. So where do I shop? Shop around the outsides, right? So you got fresh fruits and veggies over here. You got some meat over here. You got some dairy over there, and just shop there and just leave the rest. Leave it.
I love it.
And
meat,
and
dairy,
that's
and fruit and produce.
That's easy. I mean, there's nuance there, but if you just wanted to take one thing, like get rid of all the processed stuff, get rid of that.
We've done this as a family personally. We kind of follow the same guidelines for nutrition, and it's also a lot simpler.
Yeah.
Because you just know what you're going to eat every day. You know?
Yeah. Oh, and one quick thing. Just kill cereal. Kill it. Just kill it. It is a high carb situation in the morning. Like your cortisol levels are highest in the morning. They break down fat, they break down sugar, they kind of help maintain your energy levels and things like that. And if you hit a sweet, sugary breakfast, or your kids do, it tanks their cortisol. And then in the afternoon, they have a hard time focusing. They're kind of sluggish and sleepy and doing all these things. We're hijacking the attention of our children by sugaring them up in the mornings.
And now by cereal, you're talking like cereal boxes.
You bet.
Warm cereals like oatmeal or cream of wheat.
I mean, they're all full of sugar unless you make it yourself and you do the bigger oats. And there's a 7-grain at like Winco that's really good. There's a few of them that are decent. But honestly, like for adults, maybe skip breakfast, like hydrate well, and then eat like around 10 or 11. That's great. And then eat a reasonable dinner, and that's probably good for adults. For kids, maybe give them like a more protein heavy breakfast. Like here's some eggs, here's some whole grains. That's cool. But skip that sugary cereal crap, because
just minimally processed food, right?
Yeah,
you got it.
When you think about all those.
Yep.
So General Mills is not the solution.
Kellogg and all those rascals. Yeah,
gotcha.
Just around wellness culture. It's good and bad. It's doing a lot of good, but the bad is, like you said, misinformation. So are there like some common themes around or misinformation that you see you wish people wouldn't listen to?
I think there's a whole movement around anti-doctorisms, right? So in the algorithmic space, the rabbit holes of misinformation, that then algorithmically feed your brain. If you click on one of those, then you're going to be algorithmically fed the next little bit of things to push you further down that wackadoo rabbit hole. We call it wackadoo rabbit holes. It's a technical term. But it's hard because there's like all this distrust and there's a social distrust of physicians as well. Totally. And understandably so, because we're killing it ourselves by spending 5 minutes with people and allowing this broken system to dictate the way that we treat people. And that's silly. So can we, I think looking at that and recognizing if you're being algorithmically fed a bunch of hooey, that's really hard when you're going down the rabbit hole because you're like, whoa, this is so intriguing. And wow, this is so sophisticated. They're so sophisticated at driving people down these rabbit holes. I'm a PhD virologist and I'm here to tell you blah, 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 blah. And then it's like this, and it's so intriguing. It looks like a documentary, like it's real. And then they show you this thing that's supposed to be a thing and it's not. And only I mean, scientists know that. They're like, that's a screensaver, actually. That's not a magnetic microscope telling you that these cells have been damaged by whatever.
And a lot of those contents, even AI generated, it's not even real people talking.
Nowadays,
So this is kind of interesting. Just, we talked about limiting screen time from the dopamine standpoint and how it disrupts sleep and creates this addiction and dependency. But even just the information quality within that can lead us down these, what did you call them? The
wackadoo
rabbit holes. Just the quality of information. I mean, there's also, there's what's happening in our brain to this constant short cycle of dopamine hits, but then the information we're consuming is usually lower quality. I mean, there's a lot of great information on YouTube. I mean, there's a lot of it, but generally I try to read books and listen to filtered podcasts with, good trusted experts and try to get less information from the quicker the information can be consumed, the higher risk you are at being manipulated to misinformation. Just my experience.
Luke, those are nuggets from a tech guru. And I want my people to hear that message. Like the quicker it can be consumed, it's dangerous, and maybe look to better sources like reasonable podcasts and reasonable books. Like look to these old
published
school
research.
Published research. Look to some other spaces for information. The quicker it can be consumed, it's a little bit more dangerous. And that is true because they're doom scrolling, they're keeping you there, and they're quick and they're rapid fire, and then they shoot to the next one. And that's cool. That's really good. Yeah. That's really good.
I love what you're doing. I applaud you, admire you. And it's probably harder to replicate some of what you're doing beyond preventative. But you're specific to, I mean, you're a doctor, people come in for primary care. If we think, and as our bodies and minds are holistically integrated, I think that the care of humans should also be. But today we have medicine and we have mental health care and we have doctors and we have therapists and psychiatrists and psychologists. But if we're, and ideally the way you're doing things in your business, your practice is bringing those more closely together. But if we're looking at just the mental health care space, how do we move that space into more preventative? Because that's another space where the demand is so high. The demand for mental health care is far outpacing the supply of therapists. And governments are trying to lower licensing requirements to bring more supply in. They're doing lots of things to try to address this supply-demand gap. But for me, I think long-term, we'll never get ahead of it until we make it truly preventative. It's the fence or ambulance. We'll never have enough ambulances. Let's start building fences. Now, I know your background is mostly in preventive care, but you've given a lot of thought to this. How do we move the mental health industry more to preventative?
I think a very simple thing, if I ruled the world, I would implement Mark Brackett's ruler curriculum in every school, starting in elementary or even younger. Implement that and train the teachers on how to do that. It is an emotional intelligence curriculum, and emotional intelligence is bring understanding to it. First thing, bring it. So is emotional intelligence better than like intelligence? Which one has better success scores in life? It's actually emotional intelligence. Mm-hmm. You can be the smartest person in the world, and if your emotional intelligence sucks, you might not be as successful. And I think that's step number one, just recognize the need for it. And then number two is Mark Brackett's curriculum, that way we are better at it. Like it's the Ruler curriculum, RULER. It's an acronym. He's the head of the, at least he was the head of the Center of Emotional Intelligence from Yale. And it's like a national thing. And schools can I think license his little program to kind of do that. But I think bring it to the schools, start teaching children and their parents emotional intelligence principles. Recognize, understand, label, express, and then regulate. That's Ruler. And I think that's so powerful. Just that alone. I grew up in a family in a mining town with an alcoholic dad, and there was like zero emotional intelligence. And I'm like, whoa, what is this thing? And so I think it's important for us to look at it as parents, because it has to start here. And then if you just like learn the acronym and like literally go online and listen to a few podcasts about the Ruler curriculum and then implement that in your family and implement that in the school districts and then emphasize it in health. How are we doing? When crap goes sideways and someone's having this emotional meltdown thing, it's like, hey man, let's do the Ruler thing, remember? And then let's sit down and talk it through and work on that. And in your relationships with your loved ones, do that. And then I think that just that alone would bring so much prevention to the emotional space, like a tremendous amount.
I love where you went with that. I was talking about making mental health care more preventative and was probably thinking more in a shorter 5-year time frame in terms of 5 years before mental illnesses are developing. You went immediately to, we need to start teaching emotional intelligence in our young people to prevent a lifetime of mental illnesses. I really love that.
There are so many tools that you guys give to people through your software and through your efforts that are so valuable. And I didn't even learn that those tools existed until I was like in my 30s. Like what? Like I should have been working on that stuff. And they were all blind spots. I didn't even see them. And so I feel like we got to fill those cracks in way earlier, way sooner for kids, so they'll be better 7th graders, because 7th graders are all atrocious. And then maybe they'll be better high schoolers, and maybe they'll be better, parents and all that stuff. So I feel like just, implement it way sooner and teach the tricks, man. There's tips and tricks that are like voodoo magic. Like what? A communication curriculum? Like, I feel like you should talk and listen and restate. Like what? Like simple stuff that I feel like most folks are lacking. They don't even see that they lack that. They don't even know it.
Absolutely. I love that.
Yeah, look, what's your main takeaway so far?
Oh, mine is, it's just simple. Like for listeners, I would say what I gained is simplify your life, like less screens, less ingredients in your food, prioritize sleep, and do all those things to create a space for yourself and to connect with other human beings. Like that wasn't even directly said here, but just that's kind of what I gained from this episode.
Yeah, mine are twofold. One, we need more Dr. Sanders in the world.
Yes.
And I love what you're doing and wish that my family lived in your town, and you would become our primary care doctor. But I think along the lines of what you just said, Luke, the main takeaway from a mental fitness standpoint is we ask a medical doctor the number one tip for health, physical and mental wellness, and his immediate answer was sleep. And then the first tip to improving sleep is limiting screen time. And that we've come at that from so many different angles, from so many different guests and areas of expertise, that why can't we figure that out as a society? But we need to be sleeping better and we need to be limiting our screen time.
Yeah. We do a segment, rapid fire questions. They're just fun. Try not to think too much about them.
Blue.
Perfect. What's your go-to comfort meal after a long day? It's funny. We just talked about comfort meals in Texas, but
okay. So I didn't realize this until just recently on one of my mushroom foraging excursions, but matsutake mushrooms are so comfortable. Like I'd never eaten one before, and I finally found some and I brought them home, and literally yesterday I had them for dinner. and it was amazing.
I love
it.
that.
It was just so
Where do
amazing.
we get those?
You have to hunt for them. They are expensive otherwise. Yeah.
And you probably don't want to share your
Northwest.
location either.
Yeah, Pacific Northwest. Yeah.
One song or artist that always lifts your mood.
Ah, gosh, there's a bunch. So I love Blind Pilot. They're like an indie band of like goodness. I like Civil Wars are lovely. They're all minor keys, so it's more contemplative than lifting. And then I really like RYX, Rix, that guy. All his stuff is really good. It's good. Like contemplative, meditative goodness.
Love that. If you weren't a doctor, what would you be doing right now?
Mushroom foraging and probably doing like carpentry work for funsies. And I don't know, I really enjoy connecting with people. And so I like the mental space too. So I'd probably do something in all three.
One movie you can quote all too well.
Nacho Libre, yeah. All my kids know this. Yeah, it's like the family thing.
What's one thing you do that your patients would be surprised to know? Maybe nothing. Maybe you're an open book.
They know me pretty well. Yeah. I don't know that there's any.
They probably know about the mushroom forage.
They do. Yeah. They all, because it's pretty prolific and I'm pretty blatant about my hobbies.
Yeah.
What's your superpower outside of medicine?
I'd say it used to be pickleball. I love pickleball. And I probably self-medicated with pickleball for many years, but I think probably I like foraging and I like connecting with people and helping people up. I think influencing people north is good. Yeah.
Awesome.
Well, thank you. Thanks for being on the show. We've enjoyed talking to you.
Cool. Thanks, guys. You guys are great.